Okay, so this is the Hymen conversation, and please introduce yourself, Kizzie.
Okay, hi everyone. I'm Dr. Kizzie Shako. I'm a forensic medical practitioner, and I work for the government. Yeah, and I'm the founder of Vunja Kimya Foundation, and today we are going to demystify the hymen.
Please don't be shy, brag fully. There are 3 police surgeons in the country. Go on.
Yes, okay, there are 3 police surgeons in the country, in Nairobi County, and I'm the first female one. Well, one
The
of
only.
3, the only female police surgeon in Nairobi, Kenya, in Kenya.
Okay.
Yes.
So what does your job entail, just for background and clarity?
So what do I do? A police surgeon is a forensic physician, and a forensic physician is a doctor who deals with the living injured. So anybody who's been injured and did not die from that injury will be seen by a forensic physician, ideally. That's the best thing that needs to be done. So I attend to victims of child sexual abuse, adult sexual assault, child physical abuse and neglect. I also interview murder suspects, rape suspects. I document injuries on a medical legal report form, and I'm also a expert witness for the same. So I go to court and give evidence on what I found, what I think, just to educate the court on forensic matters.
So you're the CSI. You're
Yes.
there saying the bruise, the this came in at this angle. Isn't that such a cool job?
Yes, something like that.
Okay. So what is the hymen? I think let's start there. Who knows what the hymen is? There's a GYN in the house. Tindy, you can't put your hand up. Nobody has put their hand up. They know? Who thinks it's proof of virginity? Okay.
There's a yes somewhere.
Yes, there is a yes. Okay, go on. What is the hymen?
Okay, so the hymen, first of all, many people think they know until you're like, so tell us. And it's something I also struggled understanding, especially when I had my first child sexual assault case. I was like, I don't know what I'm doing. And so I refused to continue. And so anyway, the hymen is basically a membrane of skin that's at the vaginal entry point, to put it simply. So it's a part of the female genital anatomy that is found at the entry point or the vaginal opening as, at the entrance. It's basically at the gate before you go inside towards the cervix.
Okay.
Yeah, put simply.
So many of us think it is the gate.
Yes, people actually think it's the gate.
And then when
That
intercourse
blocks
or
everything.
penetration, yes, occurs, then the gate is broken.
Pop.
Yes.
It just bursts open. It's shattered and it breaks, and then there's entry, and it's so dramatic. That's everyone has this this concept of a very dramatic entrance, but it's nothing like that. It's actually it's very misunderstood. So the hymen is we need this diagram.
We have diagrams.
Please hold for me.
Yes. Everybody, ladies, your vagina, your hymen.
I don't know if you can see this, but imagine you are looking at a female who's lying on her back with her legs apart. So you'll be, this will be the genital region. These are the lips. You've heard of labia majora, right? And labia minora, or big lips and small lips. So these are the big ones and the small ones. And then there's the urethral meatus, or the area that urine comes out from. That's right there. The clitoris, you all know your clitoris. That's up there.
Who didn't know? You can thank me later.
And then that right there, that's circled in white, is the hymen. Right? And you can see there's an opening, vaginal opening here. So people think that there's a cover, a seal, that it's sealed, that the hymen does not, that it's a complete membrane, and then only when someone puts himself inside is when there's an opening, and then that's a broken hymen. But that's not correct. This is how we are born. Females are born like this. There's always an opening. And we can continue to explain further. Sorry, it's upside down.
Woohoo! They're all white people. Karen joked that we should take selfies in the bathroom.
Oh my God.
And then come out with them. But okay, go on.
I hadn't even noticed that. Anyway, so the hymen would go through changes from when a female is born all the way to adulthood. There's different changes in the way that the hymen would appear based on the hormone estrogen that's acting upon that part of the body. At birth, there's the mother's estrogen that is still present in the female's body, and but after a few weeks, it subsides, and then this is what you would be. This is really what we see most of the time, a crescent-shaped hymen, and you see there's an opening, so it's not blocked. Those that are females who are born with a sealed hymen, it's not normal, and it's a rare condition that needs surgical intervention. Yes, because then when menses begins, it can't flow through, and so you need it surgically repaired. So this is normal. Then it can be annular or circular shaped like this. I hope you can see. Then when you have your estrogen, you want to stand up and then when you have the estrogen levels rising at puberty, the hymenal membrane begins to become, at this point before puberty, it's very thin and delicate and pink, and just, it just looks delicate, you see, like it's a thin membrane. After estrogen estrogen levels increase, the hymenal membrane becomes thicker, more elastic, and fluffy. Like, people describe it as a flower. This is when it begins to look like a flower. Just fluffy with irregular margins, because the whole point is for the body is beginning to prepare itself for copulation and procreation. And so you don't want that every time this person is engaging in intercourse, they're getting injured the way they would here. Do you understand? Great. And so it becomes like that, and there's more lubrication. It's more elastic, and that's why even during sexual assault or rape, there may not be any injuries, because the body is beginning to prepare for that kind of activity anyway. Do you understand? Yes.
So you're probably wondering why this fits into finishing well. It kind of doesn't. Kizzie just put up a post on Facebook, was it about 6 weeks ago? Yeah. And the debate that came up, it made me realize just how little women know about our actual anatomy. And even me, who's a sex writer, I don't think I'd have been able to take somebody through all of this. So I thought it's necessary as opposed to fitting in with the theme. And then Kizzie and I have been friends for a while, so I was like, Kizzie, come for Dadasphere. She's like, I'm coming. Why? And so we thought we'd have this conversation. But hymens have been used to torture women for years. Virginity tests.
Yeah, it's and even we as medical practitioners have been used to conduct or propagate that torture, because it's degrading. It's degrading for this whole concept that we have just discussed. Many people. There's been this misconception that an absent hymen, which we now know is not the case, means that there was sexual intercourse. So this person has had sex and they are no longer virgins, meaning they are impure and unclean and not worthy to be married. Because the world has always said that, the world thinks that women are measured by their ability to get married. I don't understand it, but to me, that's not what life is all about. And so sometimes you have this virginity test, which requires for the medic to figure out, has this person had sex or not, based on placing 2 fingers within the vaginal opening. And
Are people still doing this in 2018?
I believe so, yes. In some parts of the world, I believe it's still happening. But there's been a movement within the medical space to stop such things. Because there's no scientific backing, there's no evidence. We are all different. You can't say, oh yeah, this one is wider than this one, so this one is very sexually active and this one is not. We are all different, and there's just no science. There's no need for it.
Okay. So for those of us who are raising girls, how do we pass on this information to our girls? Like, this is your hymen. It means this to some people. Like,
It's a nice, what you've just said, like the way you started all this, I was like, wow, that's amazing. Well done. I'm so excited about that. So it would be good to take your daughters through it and explain what the female genitalia is, what each thing is for, which each part of the body is for, and just give her the myths and tell her, people will expect you to be clean when you get married.
Yes.
People will expect you to desire to get married, and if not, then there's something wrong with you. And this
Okay.
is what sex is all about. And the hymen is really, it's a lot of hype.
Okay.
Yeah.
You have a reason why you talk about hymens. There's a misconception in the legal world. What is that?
So every time I'm in court, I'm asked, was the hymen there or not? Just tell us.
Was the gate intact?
Yeah, was it there or not? Was it broken or not? And, I have to start explaining hymens don't just walk off. They don't disappear. It starts like this, and that same explanation. And so, hymens can move from change in appearance. And they actually heal, by the way. Hymen can tear and heal.
Please explain. For those of us who are told we must have lost our virginity on a horse or on a bicycle, did you hear those stories growing up? You don't have a hymen, you lost it riding bikes.
Yeah, so it's like you cracked it and it vanished, it ran away. That's not what happens.
Or you used a tampon and it...
Yeah, and you see, even in court, those are some of the explanations I'll give. I'll tell them that a hymen, we should not just focus on the hymen and its injuries or lack of injuries to decide whether there was penetration or not, or if it was sexual assault, or if it was consensual. We need to use other things because injuries may or may not be there. And with children especially, an injury can heal. I've seen hymens that are going through wound healing.
Oh.
Yeah, and so what would be seen in the first day after a sexual assault will be very different from a 5th day or a 6th day. So you see, even that virginity test again.
So is there a virginity test?
No.
So only a woman can tell you I'm a
only
virgin
a woman
or I'm
can
not a
tell
virgin.
you whether she's a virgin or not.
Okay. There's something you said on the phone when we were talking, that virginity is a social thing.
Yes, I believe virginity, just like this FGM and female genital mutilation, all this is because we live in a patriarchal society that demands that women's sexuality should be under control, under lock and key. You should only have sex when men think you should have sex, when the world thinks it's adequate for you to have sex, and the way it should be done. So you have to get married first, and then you can have sex. And if you're going to, get married, you have to be pure.
It's the policing of women's bodies.
Yeah, basically, just
okay.
to keep you behaving and not exploring and doing what you shouldn't be doing according to society.
Okay.
Yeah.
Okay.
Which to me is wrong.
Okay, I think that's it on hymens.